Hello there, my name is Linda Errington and I'm Medical Sciences Librarian based in the Walton Library. Today we're going to have a look at literature searching in the context of scoping and systematic reviews. In the session, I will introduce the key differences and identify the principles behind literature searching for both of these reviews. I will attempt to present a step-by-step approach to the search process and offer tips on how to manage results. The session is about the process rather than the search techniques per se. There are other search techniques sessions as part of the Your Skills programme, which you may want to investigate after this one. So let's start with the overall aims. A scoping review aims to identify all of the literature regardless of study design. The evidence base isn't critically appraised and it doesn't address one specific research question necessarily. On the other hand, a systematic review aims to identify, appraise and synthesize all of the empirical evidence that meets pre-specified eligibility criteria and answers a very specific research question. It may be that you have had guidance on what type of review you're expected to carry out from a supervisor, or you're part of a review team. Both of these different types of review are rigorous methods of summarising research evidence, and they're both designed to present findings in an unbiased way. A scoping review is often used to identify what we know and also what we don't know about a topic. So it will identify gaps in research and can be used to influence future research and or maybe bolster funding applications. A scoping review can also be a precursor to developing one or more systematic reviews once you've found out what these gaps are. So both reviews aim to identify all of the relevant research studies and present a balanced and impartial summary of the findings. So they must be based on a sound literature search strategy. The results of the review can only be as good as the search strategy that they are based on. If the search strategy is flawed, then studies could be missed. If studies are missed, then the findings may not be balanced and may be biased. So looking at a scoping review in a little more detail, you usually start off with a broad research question or topic area. You would identify all of the relevant research within that topic using your search strategy. However, you wouldn't attempt any critical appraisal of the included studies. A scoping review would have a protocol ordinarily, but they're not necessarily published, probably not published. The protocol adopts an iterative approach for a scoping review, and they can be changed as the research develops. Scoping reviews are generally more qualitative than quantitative, and as I said, they can be used to map the literature to identify research gaps as well as knowledge to inform future research statements or to identify key concepts within a broader topic. So to give an example, I was recently involved in a scoping review which looked at the experience of hospital patients with multiple long-term conditions. So because it was looking at experience, it was qualitative research that we were interested in, and we were looking to identify what the issues were, what the experience was of those hospitalised patients, and how future research may help to inform the management of such patients. So we identified some specific research areas from that scoping review, which we now intend to turn into systematic reviews. So the systematic review is used to formulate a conclusion in answer to a focused research question. It will identify all relevant research and assess the quality of the existing evidence and the risk of bias. So critical appraisal and risk of bias assessment is mandatory in systematic reviews, and standardized tools have been developed to help with this element of the process. So the systematic review is based on a set research protocol. So unlike the scoping review protocol, it isn't iterative, it is set. It is at the outset, it includes clear inclusion and exclusion criteria, and often a systematic review protocol will actually be registered. It could be a requirement of the funding body or some such, and there are a variety of resources where you will find published systematic review protocols, Prospero, Cochrane Library, Campbell Collaboration being among them. So systematic reviews often include quantitative analysis. Systematic reviews of healthcare interventions traditionally covered precise research questions regarding clinical effectiveness. So when they first started to appear, oftentimes they were looking at how effective a drug was in terms of treating a condition. And they looked at randomized controlled trials. So the randomized controlled trial would split participants into experimental groups and control groups. So you would have the group who were administered the drug and a group who were administered a placebo. The results would be compared and the effectiveness of the drug would be determined from that. So that's historically largely how they came about. Systematic review research has moved on hugely from that. Outside of clinical effectiveness into more broadly medicine, healthcare, and also out with that into all disciplines now. The systematic review research has moved on. The methodology lends itself very well to quantitative analysis, regardless of what discipline you're working in. So depending upon the results that you find and the data that is within each of these individual studies that you would include in the review, a meta-analysis can sometimes be used to pool data and statistically identify overall trends of results. Now, in order to do so, that data must be sufficiently homogeneous in order to be comparable. You won't know that at the outset, so it might be that you intend to carry out a systematic review, which includes a meta-analysis, but you won't know whether or not it's actually possible to do so until further down the line, and that's absolutely fine. If you can carry out a meta-analysis, you will pool the data and your overall conclusion will be much more reliable than can be derived from any one single study. To give an example of a systematic review that I've recently been involved in, we looked at administering a specific antibiotic for 1 week duration to treat a condition in comparison to administering the same antibiotic for a 4-week period for that condition, and the results were compared and guidelines were written as a result. So that was a very, very specific focused research question, and we were able to produce a quantitative analysis, including meta-analysis in that instance. So on this slide, I've attempted to identify the crossover between a systematic and scoping review. All of the steps on the slide are required for a systematic review, whereas only the steps in blue are required for a scoping review. Hopefully it's self-explanatory there, but just to point out a few things. Step 3, although not absolutely necessary for a scoping review, it is still good to have a protocol. It may not be published. but it can be very helpful for you to actually refer back to. Reviews can be quite a commitment, and there may be times when you question what your initial reasoning was, and the protocol can help with that. So it will help you keep on track, basically. In terms of step 4, identifying appropriate bibliographic sources, then the search strategy and the resources are absolutely crucial to the quality of the resulting review. You need to identify all of the relevant research and therefore all of the full range of resources which index that research. So if you need help with that, your subject liaison librarian will be able to offer advice. For the quality assessment, the data extraction, standardized tools do exist to perform necessary assessments and risk of bias. So it might be worth having a look into which of those tools are best in your subject area. Your subject librarian will be able to support you through steps 4 to 6. Anything outside of that, you may need to seek advice from your supervisor or other team members. So taking a step back to that all-important literature search process, where do you start? Well, you do need to define the elements of your research question, and there are various models to help. I've given the acronyms of a few there. So we've got PICO, PICOS, SPIDER and SPICE. PICO it looks at the patient, intervention, comparator and outcome. PICO is commonly used in medicine and is most useful for quantitative studies. SPIDER is sample, phenomenon of interest, design, evaluation and research type. And SPIDER is commonly used for qualitative and mixed methods research. SPICE, another one, it looks at setting, perspective, intervention, comparison and evaluation. So it's worth trying these to see which model works best with your research question. Can you break it down by patient, intervention, comparison, etc.? Is it more useful to you to look at setting, perspective and intervention? Have a go, see how they pan out. There is no absolute right or wrong. You would then, once you've actually decided which, if any, of those models are useful to you, you would list the keywords and terms, as well as a full list of synonyms, which help to break down the content of your question. So you will end up with a list of concepts, and within those concepts, lists of alternate terms. You can look at identifying justifiable limiting factors for your systematic review or your scoping review. Justification is important. It wouldn't be acceptable, for example, to limit to the last 5 years in either review type, just because it's convenient. It would find you a manageable amount of research. That wouldn't be an acceptable justification. You're meant to be looking at all of the published research, unless, of course, there is a very good reason why the last 5 years worth of research is specifically useful to your particular area of interest. So, for example, new guidelines might have been introduced on how you do something 5 years ago, and you're only interested in the results of what's happened since then. That would be absolutely fine. You could justify this in your methodology. So anything that you do use, any limits that you do use, you should actually acknowledge in your write-up and justify why they are in there. Similarly with your literature search, if you're limiting to English language just out of convenience, that wouldn't be acceptable. Most of the records on the databases that you will use will at least have an English language abstract, which would allow you to actually screen the article. If at the screening stage it was deemed relevant, then you could attempt to get a translation of the full text, or at the very least, you can acknowledge its existence and identify it as a limitation in your review that you weren't actually able to get the full text. So you would identify your appropriate bibliographic databases after that. So as I say, you can contact your liaison librarian for advice. And similarly with grey literature resources as well. You may or may not wish to include grey literature. Grey literature would include conference proceedings, government policy, professional standards, dissertations and theses, etc. But this should be made clear in your methodology, whether you have acknowledged that you are covering grey literature or not. So the advice would be to start with one database and create a comprehensive literature search for that database. It's likely to be an iterative approach. Your process in terms of actually building your literature search, it's unlikely that you're going to get it right first time. So build your literature search in one database, use all of those terms, your keyword terms, your limiting factors, etc. Share that with your supervisor or your research team, ask for their advice and make sure that you're thoroughly confident that you've got all of the possible terms in your search before you then start translating it across into other databases. It can be a very painful process if you carry out your search in 7 different databases and at that point decide you want to change it, because you would then have to go back and change it in all 7 resources. If you can tighten it up as closely as possible in your first database and then translate it into your other databases subsequently, it will be a much smoother process for you. There is a link to a search planner on the University Library's systematic review guide. There's a LibGuide which has a search planner which will help you to actually break down the question using the methodology, listing the keywords, adding in the limiting factors. It's a template, so please have a look at that, and you can use that to actually build this process. So it's important, particularly with your systematic review search, that your strategies are transparent and replicable. You need to know your databases so that when you're actually writing up your methodology, the name of the database, the platform, how it's structured, you are actually familiar with all of that information, so that if somebody comes along in a few years' time and wants to update your systematic review, then they know exactly what you've done. So know your databases. It's often the case where in a methodology, somebody will say that they have searched Ovid, for example. Now, Ovid isn't actually a database in its own right. Ovid is the platform, and Ovid gives access to a number of individual databases. So Medline, Embase, PsycInfo are all available via Ovid at Newcastle University. So you would need to say that you searched Ovid Medline or Ovid PsycInfo, for example, and then it would be absolutely clear to anybody reading your research what they would need to do in order to replicate that search. So you would also need to know how the database is structured. Do the databases that you're using, do they have subject indexing systems, or are they keyword searchable only? How do the databases differ from one another in terms of search functionality and search operators? That's important when you come to actually translate the searches between databases. We have a database comparison table which can help with that. And also there's a Your Skills session on transferring transferring searches between databases. So, I said it earlier, it's very important with a systematic review search that your search strategy is transparent and replicable. So your theory is somebody comes along in 4 years' time and wants to update your search, they would need to be able to reproduce your exact searches using the same resources in order to do that. You therefore need to clearly state what you've done, as I say, and your search strategy should include a combination of subject headings and keyword searching. Subject headings can be a much more reliable way to find relevant studies because they are context specific and determine the subject of the studies found, whereas keyword searching simply identifies the words which you are searching in the fields that you state, but there's no context. So you could search for the keyword for hospitalized patients, and the abstract might say, we did not consider hospitalized patients. If there's a subject heading for hospitalized patients, then those articles that the subject heading finds will actually be about hospitalized patients. So that's a very, very crude explanation, but some of the other Your Skills sessions go into that in much more detail. Subject headings do differ between databases, so you need to know which databases use which subject headings. You can't assume that a subject heading in Medline will work in Embase. They might be slightly different. Medline has more of a US bias, so they may use US terminology. Embase has more of a European bias, so the headings in Embase may have more of a European slant. So you need to understand how these databases work and how they differ. In terms of actually saving and translating your searches, each of the databases will allow you to create a personal account, so that you can actually save the search and you can go back and edit it. You can go back and rerun it, and you can search and save it as an alert as well. So if you save an alert, then you could maybe say that you want to be informed every Monday morning of any new results that have been added to the Medline database using your search strategy, for example. So again, the databases handle this differently, but please do have a look at creating accounts and saving your searches in whatever way you can. So the search needs to be translated as closely as possible into the other databases. One search in one database shouldn't include different search terms to another. So your Medline search shouldn't have different terms to your Embase search. They should be as close as you can possibly make them, with the caveat, obviously, that the subject heading might be slightly different. So check to ensure that any known relevant papers appear in the results. It's often the case that at the outset, you and your supervisor might be aware of one or more studies which you'd expect to come up in your search results, and you should be using them as a benchmark. Make sure that the studies are in your search results. If they aren't there, you want to know why they're not there, and you can search for them, see how they are indexed, include those index terms into your search strategy so that those papers are picked up. But more importantly, if you add in those terms, it will find additional papers which are indexed in the same way that you may not have known about. And keep a record of your search strategy. Systematic review searches need to be replicable. You need to keep a copy of your exact search strategy, and it's likely that it will need to be included in any subsequent write-up. So just to point out that systematic review searches can become quite unwieldy. The latest search that I've been working on is 102 steps long. I never want to have to retype those terms. So I've actually saved the search strategy in all of the databases. If one of my colleagues helpfully comes up with another term to add, I don't need to type out all of those terms again. I can edit the search to include that new term. So please, I can't emphasize enough how important it is to save what you've done to prevent yourself from painfully having to go back and do it again. So when you come to manage your references, you probably want to use some sort of bibliographic management software. So for example, EndNote or Mendeley. You can download the search results from each of the databases. Always record the overall number of references found in each database before you do any deduplicating. You need these numbers for reporting. So whether you're doing a scoping review or a systematic review, the process for recording what you have done, this systematic process, includes an overall number of references found and then the number of references found after deduplication. You need to include this in your write-up. So make sure that you don't deduplicate without making a note of what that number was first. In bibliographic management software, you can create groups, you can sort and organize the search results in whatever way you find useful. You can add research notes and labels. You can import full text PDF files for anything that you might definitely want to include, or maybe you're not sure about whether or not you want to include it, so you need to look at it in more detail. And you can annotate PDFs with highlighters and sticky notes features if that suits the way you work. You do also need to consider what software you might use for the screening process. So you will upload all of your results into EndNote, Mendeley, but then you will need to consider how you screen those to find which of the results are actually relevant, which ones you want to include in your review. Although EndNote and Mendeley aren't actually designed to screen results, they can be used for that process, but special screening software does exist as well. So a couple of examples are Rayyan and Covidence. And although technically not the area of expertise, in terms of the library staff expertise, we're often asked about screening tools because of their links to the reference management software. So I have included a slide in the presentation. So you're likely to have hundreds, possibly thousands, possibly tens of thousands of results to screen. Many of them will not be relevant, and that's to be expected. Your search will need to have been as broad as possible in order to identify anything which is potentially relevant. So you and a second screener will screen through your results using your inclusion and exclusion criteria that was part of your protocol. You would look at it title and abstract level first to try to identify anything that you can delete and anything that you can exclude. There will be a maybe section. So there will be those results where you're not quite sure whether it should be included or not. You can put those to one side and you can consult another reviewer to make a final decision on whether or not they're included. So Rayyan has a free version. Covidence is subscription only. Newcastle University don't have an institutional subscription at the moment, but it can be purchased by review teams where funding allows. So there are pockets of access to Covidence throughout the university. So it might be worth finding out what you have access to. Other tools are available, as they say on the BBC, but they are the common two that I've come across. Just going back to your inclusion and exclusion criteria, part of your protocol, when you come to screening your results, this inclusion and exclusion criteria is absolutely crucial. The clearer you are with the criteria, the easier it will be for you to screen the results, and you don't want your goalposts to move as you go through the screening process. So you don't want to be unsure about whether to include something and maybe start off not including it, and then later on in the screening process decide, oh, actually, maybe I will include that, because then you'd effectively have to start all over again. So be clear about your inclusion and exclusion criteria from the outset, and that will make it as smooth as it possibly can be. So once you've screened your results and found those which you want to include in your review, for each of those individual studies, we recommend that you carry out citation searching. So you've got your relevant article that is included, and you will want to look at the references which have been included in that article and decide if there's anything in that list of references that you may wish to include that hasn't been picked up by your search. And then if there is, you can chase references of those articles, and so on and so on. You will also check who has subsequently cited that paper. So your relevant article was written by Smith and Jones in 2014. You can actually search to see who has subsequently cited that 2014 paper, because chances are it's going to be on a very similar topic, and you may want to include it in your search. It's possible that your search results, it's probable that your search results will have picked up citing articles, but there may be instances where they haven't. So have a look to see who has subsequently cited the paper, to see if anything has been published subsequently, and also have a look at the individual authors of the relevant papers to see if they've written anything else that could be useful for your research. So this is very much a belt and braces approach to ensure that nothing is missed. You're looking backwards in time in the list of references, and you're looking forwards in time to see who has cited the papers subsequently. And this brings us on to PRISMA. Now, the PRISMA flow diagram, PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analyses, and the full search and screen process should be recorded using this flow diagram. So anything found by a citation process or by any other means might go in the top right hand box, so you've got additional records, but all of the results found by your search strategy will go in the top left hand box here. So records identified through database searching, this is where you record the number before deduplication, because it's not until this next box that you record the number after deduplication. Then you move on to the number of records that you've screened, and the screening is title and abstract level. So you will say how many you screened, how many you excluded at that stage, how many you then went on to look at in full text to assess further for eligibility, how many you excluded at that stage and what reasons you might have had, for maybe it was the wrong population group, for example. So you could put that in there. Studies included in a qualitative synthesis, studies included in, qualitative synthesis first, then quantitative synthesis and meta-analysis. So this left-hand flow diagram is for a systematic review. The right-hand diagram is for a scoping review. So any records identified through database searching, the only bit it doesn't actually include is the difference between the qualitative and quantitative. It doesn't actually split those out into separate items on the flow chart there. So we have a systematic review LibGuide, which covers much of what I've already said in more detail, and there's a link on the next slide. It's important to remember that this is a systematic process, whether it's the systematic review or the scoping review. It isn't an exact science. You will need to make some judgment calls on deciding how to search and how to select studies. So sometimes you may be searching for an exact right or wrong, and that may not exist. You may need to actually make those judgments yourself as part of the research, but make them clear in your methodology. So there are some resource links here, which I've put on the final slide. These are just a few of those mentioned. The LibGuide, the top one there, the LibGuide Systematic Reviews, has an awful lot of information. So I would refer you to that for anything further. So, questions, comments or feedback, I will request now, and I'll stop recording. However, after the event, if you have any feedback, any questions, if you want to get advice from your own subject librarian on a review that you're carrying out, please contact us. You can contact us via the Library Help email address, or there is a link to all of our help options on the library webpage given at the bottom there. Wish you all the very best with your review. Thank you very much.